Here we go. And we're live.
Hi, everyone. Hello, welcome, good evening. We're gonna go ahead and get started. Thank you so much for joining us. Welcome to our official launch of the Nurses Shift Change book, a guide for healthcare transformation, the ebook. This is really an important milestone for our movement. A guide for healthcare transformation. There's an echo on my side. Is that okay?
Go for it.
Okay, so this is an important milestone for our movement. It really is an opportunity to amplify the voices of nurse leaders who are reimagining what it means to lead with humanity, courage, and purpose. So the ebook really is our call to action, and it invites nurses at every level and in every role to see advocacy as part of our professional identity. And we are guided by 4 core pillars, which we'll hear a lot about tonight. And that really defines the shift change movement. So that's grounded in humanity, guided by ethics, driven by science, and then committed to that social justice. Tonight, we are joined by 4 distinguished contributors who bring each of them bring the pillars to life through their leadership and their lived experience. First, we have Dr. Lendra James. She is a healthcare consultant, strategist, and president of the HW Foundation Incorporated. With nearly 25 years of nursing experience, she champions workforce development, health equity, and leadership pathways for underrepresented nurses. And she's a proud co-founder of the Shift movement. She inspires nurses to use their collective power for systemic change. We also have Dr. Sharon Goldfarb. She is a nurse practitioner, educator, and public health advocate with over 35 years of experience. She co-led the national This Is Our Shot campaign, and she brings deep expertise in policy, equity, and education. Her work guides the Shift's movement commitment to evidence-based advocacy and civic engagement. We also have with us Dr. Roberto Roman. Dr. Roman is an LGBTQ plus health researcher and healthcare executive whose work centers on equity, inclusion, and justice. His research on health disparities informs the movement's policy priorities. He reminds nurses that advocacy is an ethical duty, and silence in the face of inequity is not an option, especially now. We also have with us Dr. Michelle Nelson. She is a nurse practitioner, healthcare equity advocate, and an NBNA fellow. With an MBA and a passion for leadership, she empowers nurses to expand their influence beyond the bedside. Her focus on equity and innovation strengthens our movement, the call for diverse leadership in healthcare. We will begin with a shared question, and then we're going to spend time exploring those pillars in depth before closing with a collective reflection on where we go from here. And also, don't worry, we do have a special link for everyone for a bundle for the ebook. So I'm just going to start with asking each of you to briefly share what really drew you to lend your voice to this ebook, and then what do you hope readers will take away from your contribution? We'll get started first with Dr. Lendra James.
Well, thank you, Gloria, for that introduction. And for me, good evening, everyone. I contributed to this book because I just felt like silence wasn't an option, right? So too many nurses have faced ethical dilemmas where the easy road is to stay quiet, but the cost of silence is burnout, it's moral injury, it's a loss of trust in our profession. And what I'll be talking about tonight is guided by ethics, right? And I know we'll get there, but I want I wanted to challenge us to stop trading comfort for compliance. And I hope that readers really walk away with the courage to make decisions that honor both their patients and themselves, right? Because ethics is not theory; it's really it's action. So I'll stop there.
Thank you. I especially like that you included that we're also honoring ourselves. Thank you. And yes, we'll dive a little bit deeper there as well. Next is Dr. Sharon Goldfarb.
So I began my nursing career in 1993, and my first job was at an HIV clinic in Harlem. And it was quite amazing to me that the patients I saw there matched up with what we now fondly call the social determinants of health or the political determinants of health. And I really realized that a huge part of my job as a new nurse was really advocating for patients and helping them have a voice where they were really disenfranchised by the system. And my career has basically followed that path of working with, some people call them vulnerable populations. I think of them as more under-resourced because I think it's a little more insidious than that. And then I started also teaching students who were unrepresented or slightly represented in nursing school, and saw that they were sort of judged with the same ruler of how far they can go, but at the same time they had fewer resources than my students who came from like wealth and money and private schools and tutors and always food on the table. And I think nurses just can see what's going on, whether it's with our patients, with our students, in the public health. And we also see that at the same time, the system is at fault. And I have been kind of frustrated around COVID and the response to COVID and the way nurses were treated and the way nursing students were treated around COVID, that we really didn't advocate for ourselves as a profession. And I was talking to some of the people who would go on to be the leadership at Nurse Shift Change. And I was saying, you know what we really need is the Million Nurse March. We need the Million Nurse March in DC to kind of say, we nurses are here, we have power, we understand as the most trusted profession, we really want and need change. And so it just sort of grew out of some little conversations. And I felt like I finally found a home for the ideas I have for the change that needs to happen. So thanks for having me.
Thank you. Yeah, I think that a lot of nurses can definitely connect with that and feel at home in this movement and at this time with the work that we're doing. So thank you for highlighting that. Next, we'll hear from Dr. Michelle Nelson. Again, just briefly share what drew you to lend your voice to the ebook, and then also what you hope that readers will take away from your contribution.
So much drew me to the ebook. First and foremost, good evening, everyone. I'm so pleased and passionate about this opportunity this evening. It is very difficult living in the state of Georgia to see the dysfunction of healthcare in our state. Georgia excels at being number one for business, but we also have the distinction of what Dr. Nelson, the academic, would call getting a Z- when it comes to healthcare. We always have the distinction of falling in the bottom 10th for our major healthcare indicators and outcomes. We fall near the bottom when it comes to maternal mortality for Black and brown women. When I moved from New York and I came to Georgia, I was told resoundingly that nurses don't work together, that we will not be able to move the needle when it comes to legislative change and healthcare policy because we operated in silos, and that we didn't have a common voice. And I made it my distinct mission to make sure that that was no longer our story. And so I got busy with a group of colleagues that decided that we were no longer going to watch others dictate what our destiny will be, We were going to take our destiny in our own hands. One of my favorite deans, Dean Linda McCauley from Emory University, came to a conference that I spearheaded one year, and she said, nurses will save healthcare. Now, that sounds like a really trivial statement, but it's true. We are the largest workforce, and we have the ability to determine where healthcare goes. As the largest healthcare workforce, we can determine who our legislative leaders are, mayor, governor, dog catcher, whatever it is that you want to say. We have the ability to determine that. But we have to also, as advocates, get people engaged and get them out of this inertia, and to let them know that they have power. So Nurses Shift Change is a wonderful, pivotal, groundbreaking movement where we can engage, lift our voices, and invite others to come along wherever they want to show up at. We're meeting with them where they are with the strategies necessary.
Thank you. Yeah, I think that is really powerful to make sure that we are meeting people where they're at. And this ebook really is that call to action, and it has practical tools to have any nurse pick it up and get running with it. So thank you for sharing that. And next, we're going to hear from Dr. Roman.
Yes, thank you. So I've been in healthcare for over 20 years and academia for over 15, and I've lived in the state of Florida for over 22 years. So for me, never thought I would really get into anything political, just do what I do on a day-to-day, do it well. And as time has evolved and passed us by, I realized that, there's a lot of voice that was missing from nursing. And, Michelle stated it that it's, we're the largest workforce in healthcare and didn't know really how to engage or what to do. And that seems to be the sentiment with a lot of nurses, like, well, how do I do what needs to be done? And it's difficult to engage. And once you find a community, a group such as Nurse Shift Change that has people that are, pointing and supporting, our patients, our communities, really gave me the opportunity to say, okay, this is where I need to be. I wanted to participate in the ebook to be able to share my story of really not knowing how to get engaged to getting engaged all the way. And with the ebook, I'm able to share my story, talk about marginalized communities and how politics has evolved over time and the damage that's happening within our communities, within marginalized areas, and sharing the stories and being the voice for the voiceless. And that's really what Nurse Shift Change in this ebook gives us the opportunity as nurses, is kind of a blueprint on how to engage and look into these areas, and how as nurses to be informed in what's happening, because once we're informed, we can then start advocating and verbalizing for communities that don't have that opportunity. So as nurses, I feel it is our ethical duty to support the people we care for from day one. And as nurses, we're the front line. We know what these policies do to the patients that make it to the ER, patients that, are going through community health centers, that are seeking care to live the healthiest life they can live. So the ebook really did give me the opportunity to share little tidbits and stories of what I've gone through, what I support, what I advocate for, and how verbalize and vocalize what we have as a profession.
Thank you. I will just quickly introduce myself. I am a public health nurse, an educator, and director of an RN to BSN program. I also am proudly a co-leader of the Nurses Shift Change movement, and really happy to be here with all of you. If you're just joining us, you're right on time. Nurses, you all are using your voices, and with this ebook, you'll be able to lead, advocate, and create real change. So we're going to dive quickly into that blueprint now and look at the pillars, as I mentioned, of the ebook. So first, we're going to look at pillar 1, and that's guided by ethics, from Dr. Lendra James. Lendra, for your chapter, Guided by Ethics, Choosing Courage Over Comfort, it reminds us that ethics in nursing is not theoretical. It's a lived experience, right? Every day in our choices and our actions, and for some in the silence. What does choosing courage over comfort look like in nursing practice today?
So it looks like speaking up when staffing is unsafe, even if it makes you unpopular, right? It looks like calling out the bias and inequities, even when the system tells you to stay quiet. It looks like courage over comfort, right? It's not about being dramatic. It's about being consistent, and it's the daily choice to really act right in alignment with the values, I should say, instead of aligning with fear. Because I know, like right now, there's a lot of fear that has been going on for quite some time, and we have to be able to speak up. And I'm sure you guys have heard this, because when we stay silent, we stay complicit.
So, how can nurses begin to rebuild that moral courage in environments that really don't always make it easy to speak up?
You have to start small, right? And what I mean is, courage is like a muscle, right? You know how we have patients and sometimes they get sick and maybe, their muscles atrophy. You have to start rebuilding those muscles. And it begins with having one hard conversation at a time. One refusal to cut corners, one moment of standing with a colleague instead of against them. So when we see organizations not standing with their employees, we have to create environments where speaking truth doesn't mean it's career suicide, right? So it's rebuilding moral courage that takes both personal practice and systemic support.
Yeah, thank you. And what advice would you offer emerging nurse leaders facing ethical challenges early in their careers, especially right now?
Right now, I would say don't confuse being quiet with being safe. Because as we can see right now, even with, shutdowns of the government, when you're quiet, it doesn't mean that you're safe. Like, silence doesn't protect your career. And actually it can compromise it. So our integrity, we have to look at our integrity. So my advice, to really anchor yourself in your why, right? And find mentors who will back you, who, when times get hard, they'll support you. And remember that your voice carries power. Like, lead with courage and not with consensus.
Thank you. Next, we're going to look at pillar 2, but just wanted to highlight again that silence isn't really a safety net, especially right now. So for all those emerging nurse leaders, just making sure that you're stepping into your power, and hopefully this ebook will assist with that. So pillar 2 is grounded in humanity, and that's from Dr. Goldfarb. So if you can look at pillar 2, grounded in humanity, your work really does remind us that soul of nursing is grounded in humanity. But in a time when healthcare often prioritizes efficiency, right, and output, your chapter does call us back to that connection. What does it mean to restore humanity in healthcare systems that often value speed over connection?
Well, they actually did a study that came out of the Chan School of Public Health at Harvard, that when you increase the speed, your outcomes get worse. And in some hospitals that moved to a speed metric, infection rates actually doubled at the hospital. So I think first we have to even challenge is this quote unquote efficiency, cost effectiveness, something that's really going to help us in the long run. And I think when we look at also the issues of patient satisfaction and the rates of the moral outrage, injury and moral outrage of healthcare workers, that it's not a model that has been working. And I think when I think about what what drove us into nursing in the first place are these qualities of compassion, empathy, kindness, and respecting the dignity in others. And I think that has to be front and center of everything we do in nursing. Um, they have done studies on empathy, and they have seen empathy in babies as young as 4 months old. And we have a thing in our brains called mirror neurons that actually, when someone is suffering, we can empathize and really feel that suffering. So to kind of turn us into, almost like robots who just have to get a job done and do it so fast, we often don't see the patient. We miss the patient. We miss their story. We miss their why, and we don't serve them. And I remember once I spent a long time with a patient of mine, and the medical director came out and said, you were only supposed to spend 15 minutes with this patient. You were with them about 45 minutes. That's not good. And I said, I'm just curious, where should I have cut my patient off? When he was telling me about thinking about suicide, or when he was telling me he was drinking until he blacked out every day, or when he was telling me about the problems in his family and how he was struggling with his life's responsibilities. Like there wasn't a 15-minute mark where I could go, let me have you rebook with the secretary and we'll pick this up. And I think if I was the kind of healthcare provider who could really turn off my patients' responses because I was looking at a clock, I wouldn't last long in the field. And I really liked what Lendra was saying before is like, we have to answer to kind of a higher authority, the humanity we see in ourselves, whether it's a spiritual practice, but a lot of times the nurse is the most important person in the patient's or a patient's family or community's life. And we make a huge difference in whether of both their quality of life and if they'll even survive at all, because we'll really take the time to listen and know them and build the trust. And sadly, that's really eroding in healthcare today.
Yeah, thank you. I think you kind of touched on it, but how can nurse leaders then model that compassionate care and protect the human side of nursing that you already mentioned?
Well, I think it has to be in every aspect of what we do. When I was a nursing student, and I know that was a long time ago, I remember I had a preceptor who was so awful to me that I would cry on the way to clinical, and then I'd cry all the way home. And this whole like culture of nurses eating their young, and I sometimes hear a faculty almost speaking with glee about flunking out students. And I think that it starts with where we start with our students. It starts with where we start with our patients. It starts where we start as team leads, that we really want to walk the talk of like compassion, empathy, kindness, and respect for the dignity in others. And it means we have to challenge the structures of racism and challenge the structures of inequality and challenge the structures of implicit bias, because it's very easy to other someone, and the system as it exists now really benefits in us othering people and giving them less good care, but we see what the outcomes are. We see the rates of perinatal um, mortality with Black moms dying 3 to 4 times the rate as white mothers. We see it with naltrexone navigators for people with substance use disorder, that the majority of prescriptions go to white patients. Like we're really not addressing the humanity, and we have to look at, we have to assess, we have to research, we have to get data, and we have to call it up, and we have to have creative visions of how things look differently. So I was the dean of one nursing school, and we had an attrition rate of 27%. And when I first started, the students who flunked out were all students of color. And when I said I was going to change the system and no one was flunking under my watch, everyone would get what they needed. We ended with an attrition rate of 3%, which was one white student leaving because of a death in the family. And I remember the faculty being like, well, our NCLEX board rates are going to pass, are going to tank. And they were only at about 79%. Well, when everyone succeeded, our board pass rates actually went up to 100%. So I think that's the kind of leadership you want. You want to see a problem differently than how it's been sold to you and look for solutions that may never have been tested.
Thank you. So if you could redesign one aspect of healthcare, as you sort of flipped that school of nursing, that one aspect of healthcare to place humanity at the center, where would you begin, or what would you tell others on where they can begin?
Well, I think it's very hard to say the one thing because there are many things and they're all interrelated. But I would say that we have models in other countries in the world, and that um, we really need to address health equity in several ways, and one of them is the financial constraints. And it used to be that an ambulance ride was free, it was sponsored by the government, it was part of the fire department and the police department. That has all become privatized, right? And now when you take an ambulance ride, you're looking at a bill, even with the best insurance, of $6,000, $10,000. People cannot afford that. People are choosing to take an Uber to get to the hospital because ambulances are so expensive. So we have to really get rid of the profit in healthcare because healthcare is a human right. And if you look at countries all over Europe where it's everyone has health insurance, the health outcomes are so much better. The quality of life is so much better. But I think we have to look at where big money is being spent in medicine, in pharma, for hospital administrators, and really change things around. Even in the pharmaceutical industry, a lot of times in the past, pharmaceuticals were developed in universities, and there were checks and balances, and there was also this sense of the greater good. Now, this has been totally privatized. Medicines that are getting developed that have a great profit margin instead of what patients might really need. So we need to fix a lot of things. And if you pull the camera way back, it's social determinants of health. If people have a nice house to live in, if they have access to healthy food, if they have green spaces where they can exercise, if they have third spaces where they can socialize, this really promotes wellness. And if you look at blue zones and the work of blue zones, where people live long, healthy lives, it's really about the quality of life and the human connection. And I think we have to really move towards that model. Sorry, there was no one thing.
No, that's many things. Thank you. Um, for pillar three, that was driven by science, Dr. Michelle Nelson. Michelle, for your chapter, evidence as a tool for advocacy, it really reframes data as power. So you emphasize that pairing evidence with lived experience does help move policy and systems. How can nurses and even emerging prospective nurses use evidence to strengthen their advocacy and influence decisions?
Well, I have to say that they're interconnected and intertwined. Most certainly, some of the most powerful evidence that you have when you are in front of a legislator, when you are giving testimony in front of legislative bodies, which I do very often, whether they're at the state or the federal level, they need to hear what is happening, boots on the ground, up to the minute information. However, science requires data. You can give all the stories that you want, all the anecdotal stories of what you see in the clinic. It has to be backed up by data, facts, statistics, because it's numbers that do not lie. It's the numbers that tell the story. When you are speaking to someone and you're able to say, I noticed that there was a gap. I conceptualized and then implemented a solution. That solution was sustainable and scalable. I was able to track the outcomes, and I can tell you that I was able to reduce diabetes, coronary artery disease, whatever it is in my clinic through this new program or initiative that I implemented. That speaks volumes. When you can speak to how much money you save, how much quality has increased, what is the safety, quality, and cost-effective profile of what it is that you're doing, that is all backed up by science, evidence-based information, as well as data and research. I've been a researcher for 20 years now. I got my PhD at Emory University. And of course, I'm trained as someone who can perform as a statistician, a researcher on obesity, metabolic syndrome, perceptions of body image, depression. But you don't have to be a big time researcher. You can start where you are. And how do you get that evidence that you need to be able to go out to the community stakeholders, the legislators, the decision makers, join your local organizations, join your national organizations. If research is not your strong suit, ask them to prepare some talking points for you that are grounded in research. It is important that you show up in whatever form you feel comfortable with the data armed with evidence. Because if you don't show up and you don't then stand up and then you don't speak up, guess what? Someone else is going to speak up for you. And they may be speaking in a language that is not one that you would want others to hear your voice in. Someone is going to speak up for you. And it's probably going to be with their best interest in mind and not representing yours. So you need to show up. You don't have to be trained with a PhD, with an MBA, with anything. You just need to be a concerned citizen and a constituent that cares about healthcare, because there are none of us in this world who will not intersect with the healthcare system. And so everyone is responsible for making sure that they are engaged and they are contributing to a healthcare landscape, an ecosystem from which they would like to belong to. Like Lendra said earlier, if you don't speak up, then complicity reigns. So silence doesn't give you a safe haven. Silence just says that you are willing to go with the status quo. And the way that the healthcare landscape looks right now, where researchers and people who have dedicated their lives to making sure that we have the most up-to-date information regarding something as simple as vaccines, which has saved countless lives, are now being put in a light where they can't be trusted. And so it is up to us to make sure that we are stepping up and we are advocating for what we know best. Because in order for nurses to save healthcare, we've got to come with the evidence.
Thank you. And you did sort of share already an example, but if you can give us another one of that evidence-based advocacy that led to a meaningful change, just for those listeners.
A few years ago, when I happened to be the state president of the Advanced Practice Association, shout out to UAPRN and all my UAPRN leaders and followers and members, we noticed that there was a significant gap. There was a gap with individuals being able to show up and being confident when they come to the Capitol. I myself, I'm a shy person. And I decided one day I was going to go down to the Capitol. And I met my amazing lobbyists. Shout out to Juliana McConnell, the senior female lobbyists under the Gold Dome. We have won so many battles together and gotten so much legislation passed. But we realized that nurses were not engaged. And so we decided to take a look, based on the evidence, at where engagement lied in the state of Georgia. And we decided, because we were now in the throes of COVID and people were not able to come to the Capitol and raise their voices. So we started a virtual program called Updated 8, where every single week we would give an overview of everything that happened at the Capitol regarding APRN legislation. We would also have guests on, everyone from the governor to anyone else that was running for office or wanted to come on and engage with nurses, to be able to hear what was going on in real time within nursing. And I can tell you, from having an evidence-based idea and trying to fill the gap with a solution that would resonate with everyone, being able to leverage social media, we have had hundreds of individuals join us on a weekly basis during the legislative session. We're even in the throes of having special updated 8 sessions out of the legislative session, because we know that that's the most crucial time for you to be able to engage with your legislators when they're back home in their districts. So I'll take you back to the first question. Make sure that you are knowledgeable and you come armed with your information. Then you seek out your legislators, because believe me when I tell you, you are the employer, they are your employee. You elect them into a position. And if they are not meeting your needs, guess what you do? You vote them out. And you move on to someone who is going to meet your interests and can be held accountable to give you the outcomes that you're seeking. And I think I speak for all of us when we say access to care as a right and not a privilege for some is what all of us are seeking.
Thank you. Yeah, that we are. Access to care is a right. Thank you. Next, we are going to look at Pillar 4. So that's committed to social justice, from Dr. Roberto Roman. So his chapter, again, nurses as policy shapers. It really is a reminder that nursing has always been a justice profession. So Roberta, how do current policy trends highlight the urgency for nurses to engage in advocacy?
Well, when we look at what's going on now and the changes in policy, the cuts to Medicare, Medicaid, the removal of funding that supports the Affordable Care Act, these are components that we need to be in tune to. And as nurses, as a profession in healthcare, we see the impact at the bedside. When we see the person that can't get their insulin refilled because they don't have the funds for it, they have to decide if they're going to pay rent, get food, or buy medications. They end up in the hospital. They end up in the ER. We then start overburdening the healthcare system that's already lost reimbursement, has lost funding to support the hospital. It's a cycle. We see it come in and out, and it just becomes more expensive. We see communities get sicker, and we need to verbalize that. As Dr. Nelson was just mentioning, we have to share these stories with representatives. So as we look at changes that have happened, even news headlines, Tylenol no longer safe because it causes autism. We need to ask ourselves, where's the evidence to support that? What are the alternatives? We need to be the voices to speak out about what we're seeing come across in headlines, to help educate our communities. So it's crucial that we take the time to speak up, speak out, and advocate right now. When we talk about social justice, according to the ANA Code of Ethics, it's provision 9. And to quote it, nurses and their professional organizations work to enact resource practices, policies, and legislation to promote social justice, eliminate health inequities, and facilitate human flourishing. So with everything that we see going on, it's contrary to what Provision 9 is trying to do. We need to step up and shout that this is not ethical. We need to shout for social justice and talk about how these current policies are harming our communities, our patients.
Yeah, so it sounds like it is reframing that advocacy is our professional responsibility rather than this political act. What first step would you recommend then for nurses listening right now, or those after that will be listening to the recording, who want to begin engaging in policy work? What first step would you recommend, other than buying our book? You'll have the link, but what else? What could be their first step?
We need to be informed. We need to understand what policies are being put out there. We need to understand the impact of those policies with our communities, with our patients. We need to know what our representatives are voting for. So that first piece is being informed, understanding the evidence, and from there you can have an informed vote, because that is the biggest part. And to Michelle's point that she said earlier, if we don't like what we're seeing, we need to vote our representatives out. We need to vote for representatives that are representing our beliefs, our values, that are supporting healthcare, that ensuring that healthcare is accessible, that there aren't unnecessary barriers preventing people from seeking healthcare. So it really is getting informed and voting and verbalizing what we know is right.
Thank you. And to tag along to that, the voting them out, it's also having the courage to assist the voting in of nurses, and making sure that we all have either the support, that we give that support, or if you're contemplating running yourself, that more nurses should run for office. Just shout out to Healing Politics for sharing the way to do that. Each of you really you've already offered powerful insight to each of the pillars. So thank you for that. But I'd like to bring now the conversation together with just one shared reflection. What does collective power look like to each of you, and how can we now sustain it beyond a single moment or an event? I know that we're building up towards the Million Nurse Rally in May of 2026. But how can nurses across the country get involved right now? Lendra, I'll pass it to you first.
There we go. So for me, I think collective power really looks like nurses refusing to be divided, right? By specialties, by roles, by titles. And it's us standing shoulder to shoulder, right? Showing up at the Million Nurse Rally in May 2026. Calling our representatives, running for office, and supporting one another in doing so. Because what's the saying, how you can do more when you stand together, right? Rather than trying to do things alone. So we have to really sustain what building systems and accountability looks like, and what building a movement looks like. So we have to build movements and not moments, if that makes sense. So that's really what I want collectively. It's really about having that collective power. It's about starting where you are, joining the movement, starting with our book. Our book gives it gives really good recommendations, suggestions, instructions on what you need to do, and provide step-by-step guidance looking at our pillars of humanities, ethics, social justice, and science.
Yeah, it really is that blueprint. And as soon as you get your hands on it, you can start. So thank you. And Dr. Goldfarb?
I think that it's very important to realize that we are a powerful group and we're an influential group, and that with power and influence comes responsibility. And I think there are a lot of places to find what resonates with you. So sometimes it's a professional or nursing organization like and they often have a policy committee, and join the committee that speaks to you. Sometimes it's if you're represented by a union, like I am at the American Federation of Teachers because I mostly teach, and I'm on the bargaining team, and I just worked on getting nurse faculty raises when they have to work clinical and holiday hours. That had never been brought up as an issue. I think there are places where we want to go outside of our nursing comfort zone too. So one of the things I've been doing recently is I joined the board of directors for my local League of Women Voters, which came out of the suffragette movement, and I sit on the National League of Women Voters Health Policy Committee. So I think there are a lot of places to say we should be here, we should be giving our perspective, and we want to function as a team. Nurses often like to be inward facing, but we are experts and we have to be outward facing, and we have to show up for our patients and our communities and say, like, we need to be here. Being on a board of directors, if you don't know about nurses on boards organization, that's a place that can help place you in a position of board of directors. And you can always reach out to me over LinkedIn and I can brainstorm with you individually, because I think the more we support each other in our growth and leadership, the better we get. And there's a lot of work to be done. So I'm really happy that I have been given opportunities, and I would love to share opportunities, because the time is now. The change is essential and people are dying, and we went into nursing to save lives. So this is a bigger role we may have ever had to play. So thank you for listening to me tonight.
No, thank you. Yeah, I think you're absolutely right that there is a lot of work to be done. And with that, there's a lot of roles that can be picked up if it's volunteer work. Obviously, you can join many organizations. Please join ours, join our movement, and you'll hear more about how to do that in the closing. But obviously, we want to hear about that ebook right now. Next is Dr. Nelson. Just what can nurses right now across the country do to get involved? What's one step that they can do?
I would say the most pressing thing, as I said before, is show up. Show up. We're not expecting anything from you, just your presence. Because when you show up, this is when you start to absorb. This is when you start to build connections. This is when you start to get ideas. This is where you become creative. This is when you start to engage in that legacy building momentum that's going to be able to carry the profession forward. If you want to ensure your legacy, the only way you can do it is by sharing with others. You cannot create a legacy in a vacuum. So you have to show up and you've got to collaborate with others. And it's just as easy as, you don't know what to do? I like to tell my students this. Find a meeting, a local meeting. Show up before the time. If it starts at 7, get there at 6:30. Scope out the room. See who's there. Set a goal for yourself. Now, if you're shy like me, you can say, I'm going to speak to 5 people today. 5 people. And you're going to go up to them and you're going to stick your hand out. Hi, my name is Michelle. And, I am an advocate for healthcare. Your name is? And tell me what it is that you represent and what you do. I'd like to invite you for coffee, tea, dinner, whatever. I've got something coming up. I've got a book launch coming up. I've got Nurses to Change. I'm part of this groundbreaking groundswell of individuals who want to see change. Come join us. Then after you have scoped out the room and you have spoken to as many people as possible and handed them your business card, you stay late. After everybody leaves, stay late. Find who's running the joint. Oh, Gloria, she looks like a mover and shaker over there. Let me go over there and double back to her one more time. Gloria, I'm looking for a mentor. They told me that you're the mover and shaker. Do you think maybe we can spend some time? I promise that I will not be too much trouble. I would just like to learn what it is that you do. This is how you quietly and you systematically build that network one by one by one. It doesn't take a monumental, demonstrative personality to get it done. Just show up. Hi, my name is, and can I buy you a cup of coffee? That's a great starting point.
Thank you. I can't imagine you being shy, but maybe you're a recovering shy person.
I'm in recovery.
Yes, yes. But thank you, though. That's really
Never
helpful.
answer anybody. Is it landing tonight? No.
Yes. Yes.
It's landing. Oh, okay. No.
Dr. Roman, how about you?
So I would say, as nurses, we're comfortable working in silos, and that's a problem. We're comfortable, you have, your med surg nurse with your med surg nurses, your ICU nurses with your ICU nurses, OR, ER. We work in silos and we're comfortable there. We need to get uncomfortable. We need to break out of these silos. We need to join organizations that support the causes that matter to us. We need to really band together and network. Dr. McCamey said it at the DMP conference a few years ago that your network is your net worth. And I believe that wholeheartedly. The network that I have around me are people that have supported me, that have mentored me, continue to pay it forward and mentor others. And collectively, we come together to make this movement. And I loved what you said, Dr. Lendritz. We're not talking about a moment, we're talking about a movement. And joining Nurses Shift Change for me is part of that movement, being a part of this change, being a part of this voice, sharing what we're seeing, advocating for what we know is right, living by the code of ethics for the nursing profession and healthcare. It's all about collectivism. It's about working together and calling out what we know is wrong, calling out what we know is hurting people, calling out what we know is killing people. And, without this collective effort, our voices are small. We are the largest healthcare profession, largest workers in healthcare. We are a powerful voice to be reckoned with, but we need to get our voice together. We need to quit working in these little silos and dealing with little fires here and there, because when we say healthcare is on fire, it's on fire. And we need to put it out. We need to get it right. We need to move forward, and we need to move the US. We don't even rank in the top of healthcare globally. We need to move us to where we know we should be.
Thank you. I hope that
Can I
everybody who joined. Oh,
thing
sure.
that
Yeah.
Dr. Roman said? One other thing that we must not do is admonish or criticize each other in public. Okay? Standing together means standing and unless you see some type of illegality and something going wrong, there are always going to be individuals that have different points of view. But we see other professions, and I'm not going to call them out, they stand together against us and use their dollars against us. We have to follow suit. We have to stand together. We need to pool resources, and we need to fight. No one can beat us. No one can beat us if we all stood together.
Thank you. Yeah, I felt that. Thank you. We're on fire right now. We're on fire. So thank you. I think to everyone who joined and who will be watching this recording, please check us out on our website, nursesshiftchange.com. Sign up for the rally. Sign up for the next event that we have. It's actually next week. I'm looking at Lendra, October 9th. It's October 9th. So please join us for that. And as far as the ebook, there will be a link, and that's going to be a very special bundle that we're offering for those that are watching. And it's going to be a limited offering of a code. So please get the ebook, get that blueprint, because it really is that first step for everyone that's listening. And share this with 3 or 4 other colleagues. And that's how this grows and becomes even more powerful, because I think this movement is already bigger than any one person or, 5, 6, 10 people. It's bigger now, and it's only going to continue to grow when we all come together in May of 2026. So thank you for believing in this work, for being part of the shift. If you haven't joined, we welcome you to do so. And again, that ebook, Nurses Shift Change, a guide for healthcare transformation, is available right now. So we invite you to read it, share it, really engage with it, use it as a tool, and then for dialogue and for action, and share back. So report back to us. How did this help you? Or what else are you doing with it? What is it making you think about for the next steps for yourself? And together we are grounded again in humanity, guided by ethics, driven by science, and really committed to social justice. Together we are the shift. Again, download the ebook. It's available right now for purchase, and we have a special code for you. Lendra, any other final thoughts?
I really want to thank everyone for joining us tonight. I mean, what we put into this ebook, and as Michelle mentioned earlier, this is the first of a series. The ebook right now is available. I put the link in the chat for everyone, and you also have the opportunity to pre-order a bundle. And as Michelle mentioned, you can use them as, stocking stuffers. The pre-order for the bundle will be available on November 1st. And really use this as a guide, as a tool, so that you'll know where to start. And I think you said it best, Gloria. It's a great blueprint. It will give you confidence to take your first steps. It will let you know who you need to contact, and it'll also just open up your mind to a lot of things that we don't always consider as nurses. And one thing I want to make sure that I really drive home, as we spoke tonight, we spoke to our pillars as an organization for Nurses Shift Change. We are guided by humanities, we're grounded in humanities, guided by ethics, social justice, and the science. And they're so important, and they're essential right now to our practice, to our profession. And I want to thank everyone for joining us tonight, and for all of you for your contribution to the book, for your contribution to tonight and to this movement. So thank you to everyone who's watching, whether you're watching on recording. Thank you for everyone who's joining. Be sure to share the ebook, share it with your communities. Like I said, pre-order the bundle, and it's going to be the first of a series of information and blueprints for you to take with you for your profession and for your communities.
Thank you, everyone. Thank you. Bye-bye.
Bye-bye.